Hello, my name is Angelica Sterrett. This is my submission for IV piggyback medication. So I'm going to go ahead and get started. I have my MAR here. Um, sorry, I have my patient in front of me. Let me go ahead and reposition you and hopefully you can get a better look at everything. Okay, so I'm going to look at my MAR first, and I'm going to look at the patient name and date of birth, which is Millie Larson. Date of birth is 1/1/1936. According to her MAR, she has no known allergies. For her, she already has normal saline running, but we're going to give her an IV piggyback for her urinary tract infection of ciprofloxacin, 200 milligrams in a 50 milliliter bag of 0.9% sodium chloride. IVPB, we're going to run it over 30 minutes with a drop factor of 15 drops per milliliter. So I'm going to go ahead and do the math. 50 mil over 30 minutes times 15 drops over 1 mil. 50 times 15 equals 750 divided by 30. Okay, so we have 25 drops per minute. I'm going to go ahead and write myself a note. 25 GTT per minute. And just to be sure that I have the math right, I'm going to do that a couple more times. Yeah, so I have 25 drops per minute. Okay, 25 drops per minute. Good. Okay, I have verified that it is the correct time, the correct dose, and ciprofloxacin, since I'm going to be piggybacking that off of the sodium chloride, they are compatible to run together, so that's all safe there. It's the right situation. All my rights are completed. Okay, so I'm going to go ahead and wash my hands and get my supplies together. Hopefully you can see everything all right. Okay, so we have our mini bag of ciprofloxacin. So now that I've pulled the med, I'm going to do my double check against my MAR. So we have my 50 milliliter bag of ciprofloxacin, 200 milligrams in 0.9% sodium chloride IV piggyback. We're going to run it over 30 minutes. Do the math for that for your UTI. It is due now, and she has no known allergies. It is for patient Millie Larson, date of birth 1/1/1936. Okay, everything looks right there. So I have my medication. I'm going to grab a secondary line, and I'm going to look at the expiration date there. Oh, the expiration is July 2022. It's only May of 22, so we are still good there. Also, the package is intact. There's nothing in the medication that isn't supposed to be there. It doesn't look abnormally cloudy or anything like that. The secondary line is completely intact. There's no perforations. It is within the expiration date, and it is the correct drop rate. And I'm going to get alcohol swab to wipe the port and a label for when I hang the medication. Okay, now that I have all my supplies, let's go ahead and go see the patient. So, knock, knock, knock. Hello, Millie. This is Angel, your Excelsior College student nurse. Is it all right if I come in? Yes? Okay, I'm going to go ahead and pull the curtain and I'm going to wash my hands. I'm going to put everything here on the side table. And I'm going to wash my hands. Millie, can I please get your first and last name as well as your birthday? Yes, my name is Millie Larson. My birthday is 1/1/1936. All right, that matches my MAR here. And the medical ID number of 123456 also matches. Okay, thank you so much. So I'm going to go ahead and get everything set up. We have our patient here, and the normal saline is running. So we need to keep everything as aseptic as possible. Actually, before I get everything started or opened, I'm going to go ahead and do my third check just to make sure that I have the right medication against her MAR. So we have the right patient, Millie Larson, and we confirm the date of birth. Millie, do you have any allergies? No, you don't? Okay, I just wanted to make sure because that's what your MAR says. So we are giving ciprofloxacin 200 milligrams in a 50 milliliter bag. That's correct. It's mixed with 0.9% sodium chloride. That's right. And we're hanging it off of normal saline, 0.9. Perfect. So that all goes together. I already did the math. We're going to be giving it at 25 drops per minute. Okay, everything looks good there. Now, aseptically, I'm going to make sure to open this as carefully as possible. When I'm opening it, I'm going to make sure that everything is intact, that the line looks good. Just going to put that there. The caps are still on the ends of both sides of the spike and the IV side, and I'm going to roll it shut. Everything is intact there. This bag. Bag really does not want to open. Trying to make sure I don't rip the mini bag. Okay. Okay, so we've got to make sure that we don't touch the end there. Look at the fluid, all looks good. Making sure to not touch anything except for what needs to be touched. That goes inside. Before I invert it, make sure that's closed. Okay, I'm going to carefully fill the chamber. About between a third and halfway. I'm going to prime the line, making sure that we don't lose any medication. Just making sure there's no air bubbles in the line. Perfect. No bubbles, and we didn't lose any medication either. going to wash my hands and put on gloves. Also, I didn't verbalize it, but I put the main line down because the secondary line has to be higher than the first line. All right, Millie, I'm just going to assess your arm real quick, if that's okay. All right, so I'm going to assess the arm, make sure that there's no redness, swelling, discomfort. Millie, do you feel all right? Yes. Is there any pain? No. Okay, wonderful. So it's not hot to the touch. It feels good. Happy with that. We're going to make sure that the main line is clamped shut. Okay, so that's not running anymore. And then I'm going to use an alcohol wipe. And cleanse that vigorously for 5 to 10 seconds. Okay, that's good. And then making sure to not touch that, we're going to unscrew secondary line, connect that. Okay, so that looks all good. Make sure that they're both clamped. And then we are going to fully open the secondary line. The bottom one is still clamped, because the one closest to the patient is the one that's going to maintain the drip rate. And we have the drip rate of 25 drops per minute. Let me just make sure I have everything that I need here. Okay, so now I'm going to count for a full minute, getting 25 drops. So that's about 2 drops per 5 seconds. So let's get that going, nice and slow. Now, Millie, before I actually start administering this, I just want to make sure you understand that this medication this is an antibiotic that your doctor ordered for you, and it's just to treat your urinary tract infection. Do you have any questions about that? No? Okay. Just wanted to double check with you before I start administering it. So now I'm going to start unrolling it. Okay. Down this touch. Okay. I think that's about 2 drops per 5 seconds. Start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Okay, perfect. All right, so now I'm going to wash my hands and put gloves on one more time to assess my patients. Going to palpate the arm. Any discomfort, Millie? No? Okay, wonderful. I'll be back to check on you. Please let me know if the medication starts hurting you, if you have any pain or discomfort. And I'm going to go ahead and get rid of my trash and put my label on for when I started that. Leave her in a safe position. Make sure the call light is in reach, and if she has any questions, please give me a call. And now I'm going to go document in my MAR. Thank you.